Hi, I'm Dr. Jerry Rosenstein. How are you? Today I'm going to go over some frequently asked questions that patients have asked me in the past. First question is, a lot of times people will say, will I always see the doctor, or will I sometimes see a nurse practitioner or a nurse? And my patients will always come and see me personally. You may see a nurse also for vital signs, but they will see me with every visit. Patients ask what hospitals I practice at. I have full privileges, and I practice at both Lourdes Hospital and Wilson Hospital for both gynecology care and surgery, as well as obstetrics and deliveries. I also have full privileges at Binghamton General Hospital for gynecology procedures. Do I need to see the doctor to order tests such as bone density or mammograms or annual blood exams? Well, for mammograms, no, you don't need to see me first. You can call the office and we can call an order for a mammogram. But for bone density and most blood tests, that's discussed at the annual exam, and then we will order those things. What type of insurance do I take? Well, I take almost every insurance available at present. There may be some very rare ones that I don't, and we can check that when you call or when we see you in the office. But in general, I take all insurances. What should I wear for an office procedure? Well, anything loose-fitting and comfortable is usually fine. An outfit such as a running suit or with an elastic-waisted pair of slacks and a button-down blouse or top is also good. After a procedure or surgery, what conditions warrant a call to the office? Well, if there's any moderate or heavy bleeding, or any significant pain, or any discharge from the incision, or any fever, any of those you call, even if it's in the middle of the night. Sometimes if there's heavy bleeding, you need to call right away. As far as specifically obstetrical questions, patients sometimes ask, what things can they do before their first obstetric visit? You can do a pregnancy test. You can get an inexpensive pregnancy test from any of the drugstores or even from the dollar store to confirm your pregnancy. You can start on prenatal vitamins. Actually, even better would be before you become pregnant, but as soon as you know that you're pregnant. If you smoke, you should stop. If you drink alcohol, you should avoid any alcohol during a pregnancy. You should also avoid eating certain fish: shark, mackerel, tilefish, and excess tuna. All of those contain mercury, which can cause problems in a pregnancy. What can I take for vomiting? A lot of patients have asked. Saltine crackers or sips of ginger ale or flat soda, flat cola is often good. There are medications that we use sometimes. There are wristbands that you can get that are sold for seasickness called C-bands that work very well. Also, there are certain things like vitamin B6 that also decrease nausea, and you can call and we can discuss that at an appointment as well. Sometimes patients will ask if ultrasounds are safe for a mother and a baby, and they're definitely safe. We use ultrasound fairly frequently now in obstetrics, sometimes 3 or 4 times in each pregnancy. They're never been shown to cause any difficulty or problem whatsoever. Does Dr. Rosenstein treat high-risk pregnancies, and how is a high-risk pregnancy different from a regular pregnancy? Well, yes, I treat high-risk pregnancies. I've seen a lot of high-risk pregnancies. Those are any that have any medical risk to the mother or to the baby, such as if the mother has high blood pressure or diabetes, or if she's had bleeding problems. Sometimes this is from history as from a previous pregnancy. Sometimes it's during the current pregnancy. Also, certain surgeries like a previous C-section or other abdominal surgeries may make somebody high risk. We will go over all those different risk factors when we see you for your first obstetric visit. How often would I come for an obstetric visit during a pregnancy? Well, usually for the first 7 months, we see patients about every 4 weeks. In the 8th month, every 2 weeks, and in the last month, every week. The first visit should be somewhere between 6 and 10 weeks, if possible, and often we will do a quick ultrasound at that point to confirm the pregnancy, to make sure there's no problems, make sure the fetus has a good heart rate, etc. We can also tell at that point how many fetuses there are, if there's twins or not. Later on in the pregnancy, patients will sometimes ask, what are the signs of labor and what you should do about them? Well, if you start getting contractions and they get closer together, you should start timing them when they get regular especially. Once they get approximately over 5 minutes apart, and they stay every 5 minutes apart for 45 minutes to an hour, you should either call our office or just go over to labor and delivery. Also, if you break your water and there's a watery liquid dripping down your leg, that would be the time to either call or go into the hospital to labor and delivery. So I've been asked also, when is airline travel considered safe? Typically, before 32 weeks, it's okay to be in an airplane, preferably the pressurized airplanes. The smaller propeller airplanes aren't pressurized, so they can sometimes be a problem. After 32 weeks, it's probably not as safe, and especially after 35 weeks, you want to stay fairly close to home in case you go into labor. Patients will also ask what medications they can take for a headache or fever, things like that. Tylenol is safe in pregnancy. We do want to avoid aspirin and ibuprofen and other medications like those, however. Many cold medications like Actifed or Sudafed or Benadryl or Claritin are all safe. Are there benefits to breastfeeding, and what are they? In general, breastfeeding is probably the safest thing for the baby. The baby also gets a lot of antibodies through the breast milk, which is very good for the baby's health. It has the right balance of protein and sugar and nutrients. If you can't breastfeed, the formulas are very good as well, but breastfeeding is considered the safest and best thing for the baby for as long as possible, up to 6 months or even a year. If there are any other questions, people can feel free to call me at the office. I'm in Johnson City at 30 Harrison Street. The phone number there is 763-8391. I also have an office in Owego, and we can make appointments for both offices from the phone number 763-8391. Thank you, and have a good annual exam and a good healthy pregnancy.